I know it sounds crazy, but sometimes you do have to remind clinicians that you are a woman and you're trying to figure out, well, why do I sound like a dude all of a sudden? It's your hormones. That food plus shows up like, weird girl, where did you come from? But my breaking point was throwing out the garbage. Oh, it doesn't make sense. But that's what happened. And let me tell you why. Hey, you guys. So, Kev on stage, we may have to tell him thank you because he has the internet buzzing. And for once, a lot of women are feeling seen. So, you guys, Kev on stage posted a recent video, and a lot of women have responded to this video. It seems like a lot of women just have not felt seen or heard when it comes to menopause and perimenopause. And granted, we have been talking more about perimenopause and menopause just simply because there has been a lot of debunking, a lot of myths about HRT specifically. But even beyond that, it seems like a lot of women and men just didn't know the range of symptoms that someone can experience when it comes to the transition from perimenopause into menopause. So I'm going to talk about that today, and this is what I'm going to ask you to do. I'm going to ask you to listen to the array of symptoms that we're going to go over. But I specifically want you to take a checklist to go back into your memory bank and remember what your experience was like or is like if you are currently going through the transition, and start to really take inventory of the symptoms that you had or have currently.
Oh, I've been waiting for this. Oh boy, I've been waiting for this.
And let me know in the comments below how many symptoms of perimenopause or menopause you think you had based on the symptoms we're going to go over today. Before we get into the flashes of it all, I am Dr. T, a board certified OBGYN and also a health coach. This platform is for those who are seeking to optimize their health and want someone to help them kind of go through all the information and misinformation that's out on the socials. And so that's what our job is here. We use our expertise to help you kind of comb through the weeds of information that's on the internet so that you know what information is truly scientific and what information is someone's opinion. Now, if you are joining us for the very first time, first of all, welcome. Thank you guys for joining us. And I am so happy to have you on this particular conversation because we're about to get into a lot of details and bust a few myths. If you are rejoining us, give yourself a round of applause. Thank you so much for continuing to support the platform as we continue to strive towards our goals. Having consistent support makes a difference. And let me let you guys know, it makes a huge difference if you click that subscribe button, give us a thumbs up, and go ahead and click that notification button. Because let me tell you all, it is hard in these streets for us. There's a lot of people who have time and they use their time to do very malicious things. That's all I'm going to say. What? Ooh. For many of you, that symptom is familiar, and we're going to talk about that symptom even more. That being said, let's get into the reason why everyone is here today, the reason why I hopped on today. First, let's take a flashback as to what Kev on stage had to say.
Perimenopause is crazy because you'll hear the wildest thing ever and perimenopause be the culprit. Listen to these stories. Did you hear our coochie lips could fall off during this time? Excuse me, what? Nigga, who you telling? I'm horny and I hate people. I'm hot from the inside and it's hot outside. My titties hurt, I'm hungry, and all of a sudden I got a fupa. Where'd that come from? Everybody stank, or is that me? And why is everything so loud? The brain fog, just be talking and forget simple words. Sorry, I can't hear you over how itchy my ears are. Them itchy ears is the thing. Your ears be itching and it's perimenopausal itch. Because what do you mean I'm all itchy all the time? Why are we all waking up at 3 a.m.? Because what do you mean I turned 40 and now I have frozen shoulder? Frozen shoulder, like your shoulder hurt, it be feeling. insomnia, hot flashes, sweating during sleep, smelling everything a million times.
Wait a damn minute. What?
So, as you see, a lot of women had comments to share about their own experience, and it just created a beautiful, safe space, an unexpected safe space at that, where people felt free to share their comments. I too commented on the video. I wanted to respond to one of the symptoms he mentioned, which was the frozen shoulder. I wanted to provide some clarification as to what the frozen shoulder is. So I commented on that, which then led to someone I've gotten to know, a sister I've gotten to know, and absolutely love on the socials. And she shared that she too was going through the frozen shoulder at this time period. Now, what's interesting is that I went through or experienced a frozen shoulder during my perimenopausal time period. She's experiencing the frozen shoulder during her menopausal time period. That's just to show you guys that the symptoms are the same. And some people may experience some symptoms during the perimenopausal time period and others during the menopausal time period. And so I listed a few other symptoms on the comment, just to give people a sort of a range of symptoms that women experience throughout these transitions. Now, let's first talk about what exactly is menopause. So, menopause specifically refers to the transition in which a woman stops having her cycle. That's really all menopause is. Now, with it comes a slew of symptoms and changes to our physical and mental health. And that's where a lot of the discussion comes in. Now, menopause specifically is the lack of a cycle for a full year. If you are having symptoms and you had your cycle 3 months ago, 6 months ago, even 8 months ago, that is still perimenopause. That is not yet menopause. So from day one to day 365, there has to be no cycle for it to qualify as actual menopause. Now, there are individuals who experience surgical menopause, meaning they had surgery to remove their womb or their uterus, and that resulted in them no longer having a flow, right? However, those individuals may still have symptoms of their cycle because they still have their ovaries. Now, women who have full removal of their ovaries and their womb or their ovaries alone will experience surgical menopause. When someone transitions through the perimenopausal time period, this is the time period before menopause. So the average age, specifically in the US, and the average age is going to vary by country, but the average age of menopause in the US is somewhere between 51 and 52 years old. Some would quote 51.8 years old specifically. Now, that means that the far majority, so if you think of a bell-shaped curve, as you remember from your math classes, your bell-shaped curve is going to hit the midpoint at that 51.8 years. That means there's going to be half of the women population who are going to experience menopause later, and another half that's going to experience menopause earlier than that. So the sort of more common range of menopause is going to be experienced between 45 and 55 years old. Now, let's talk about perimenopause. Now, perimenopause is the time period in which a woman starts to experience changes in her hormonal levels, not a full decline. And sometimes during this time period, you may actually have super fertility. So keep that in mind, ladies.
But I just woke up, somebody pregnant.
But during this time period of perimenopause, there's a constant shifting of the hormonal levels with a gradual decline in the overall content of the hormones or quantity of hormones that are circulating in the blood. Now, many people may ask, how do I know? Can I check my hormones to see if I'm in menopause or perimenopause? That's not that easy. And one, because hormones are not static, they're dynamic. So I may check today, maybe slightly different from what it is tomorrow. But if you're still having your cycle, your hormones are going to be normal because it takes normal hormones in order to have a cycle. So if you're having a cycle and you're experiencing perimenopausal symptoms, don't be surprised if your hormones are completely normal. So the time period in which most women will experience perimenopausal symptoms can be as brief as a few months and as long as 10 years. Now, remember I said that the common range of menopause in the US is somewhere between 45 and 55 years old. So let's take that person who is, let's say, going through menopause at 48 years old. That is a normal age for menopause. And that individual may have experienced perimenopausal symptoms for a few months, but the range can be as long as 10 years. So if that particular individual had perimenopausal symptoms for 10 years, guess what? She may have started to experience perimenopausal symptoms as early as age 38. That's right. There are some women who will go through, and when I say women, I'm being inclusive. I'm talking about those who were born biologically female. This conversation is inclusive for everyone that fits into that category and have not transitioned with hormonal therapy. That's a completely different conversation. So I do want to make that point so that I avoid having any confusion about this discussion. So for anyone who was born biologically female, they may experience perimenopausal symptoms as early as their late 30s. This is something that I share also with the residents that rotate with us because it's really important that when they are evaluating women, that they understand that if someone comes in with a certain set of symptoms, that on that differential should include perimenopause or menopausal changes, depending on the scenario. Similarly, because we know that our metabolism change. So for those who have experienced that abdominal weight gain, you very well know that not only are there symptoms that happen during the transition, but also our metabolism change, our risk for certain outcomes like heart disease, osteoporosis starts to increase once we transition fully into menopause. So that's important for clinicians to know of all specialties. Okay, so when you are seeing someone who have a certain set of symptoms, we're going to go over some of those symptoms today. Make sure you include on the differential the transition of womanhood from being in the reproductive years to the perimenopausal and menopausal years. So let's get into what those symptoms are like. So you guys saw just a few moments ago, I was scratching my ear. Well, itching ear is actually one of the common symptoms of menopause and perimenopause. What's interesting is if you ask the general public what symptoms are common symptoms for menopause, they oftentimes will say the vasomotor symptoms. Those are your hot flashes, night sweats. And they will oftentimes also mention the irregularity of the menstrual cycle, skipped cycles, irregular flow, irregular frequency of the cycles, things like that. The main reproductive hormones of women are the estrogen and progesterone hormones. Now, these hormones are what helps to regulate our cycles and take us through a series of changes and transitions. So our adolescent years when we hit puberty, and then through our reproductive years during pregnancy, and then ultimately the transition of perimenopause and menopause. Now, these are the same hormones, which means a lot of people are going to have very similar symptoms when they're having their cycle, right? As the symptoms that they're having in their pregnancy. If you think back to your pregnancy experiences, and as we go through the list today, you're going to see a lot of overlap, especially with the first and the third trimester. You will find a lot of overlap between the hormonal symptoms that women experience in pregnancy and the hormonal symptoms we're going to talk about today. That being said, while estrogen and progesterone receptors are most commonly found on our reproductive organs, which includes your uterus, specifically the endometrium, the inner lining of the uterus, the ovaries, the fallopian tubes, and also of the breast tissue and the vajayjay. The progesterone and estrogen receptors are found on a number of other organs, including the brain, the liver, the bone, and so forth. And so, because of that, you're going to have more symptoms that women experience, not just during the perimenopause and menopausal time period, but also during pregnancy. So, some of these symptoms that we're going to go over today can be explained by the shifts and changes that are happening with estrogen and progesterone during pregnancy, and the shifts and changes that are happening with estrogen and progesterone during the menopause and perimenopausal time period. So at the very beginning, you saw me scratching my ear. Scratching ear or itchy ear is actually a potential symptom of perimenopause and menopause. Now, I say potential for intentional reason because while there are a number of symptoms that are common with the transition of perimenopause and menopause, we also have to keep in mind that other diseases and conditions and other hormones, like the thyroid, can actually cause similar symptoms. And so what I will caution everyone who's watching today is while you may be able to link your symptoms with the transition, and you may be right, I don't want you to miss other potential causes of your symptoms that may be a lot more serious when it comes to your health. So, as always, be aware and be informed, but also utilize caution and make sure that you actually discuss your symptoms with your healthcare providers because we want to make sure that you're not missing something else that could be very serious. That's going on with your body that's causing similar symptoms. So, a lot of these symptoms overlap with a number of disorders and diseases. Okay, that being said, let's get into these symptoms, shall we? So, one of these systems that's most affected by these changes or this transition period is the gut. So, the gastrointestinal system is very much not just affected by pregnancy for those who have experienced constipation and other constipation or diarrhea during pregnancy and other GI issues because of hormonal shifts, can also experience very similar symptoms during the perimenopause and menopausal time period. And so some individuals may have changes in their digestive process. They may have more bloating, more gas, more constipation, and even diarrhea. And some individuals may find that they are just more sensitive to certain foods that they haven't been sensitive to before. Some individuals may have a metallic taste in their mouth, even, and may have a decreased ability to detect certain scents and certain smells. Some individuals may have gum issues, a shift in their gums, more swollen gums, inflammation of the gums, receding gums, increased sensitivity. So the GI tract is very much linked or synced or very much affected by by hormonal changes, reproductive hormonal changes. One of the hardest symptoms of the transition is fatigue. So, for some individuals, feeling just completely exhausted and fatigued is very common. And with that, it may be just from the direct effect of the hormonal changes, or it may be from some other symptoms that are resulting in fatigue. For example, as I mentioned, some people experience night sweats, and certainly having night sweats and feeling drenched in the middle of the night can be disrupted to your sleep. Other individuals may have shortened cycles. So those shout out to the women who are up middle of the morning. All of a sudden you wake up and your sleep pattern has shifted and you're not always waking up exhausted. Like sometimes you are up and bright-eyed and bushy-tailed. So shout out to that group of women because I'm part of your group for sure. And so one thing that we oftentimes experience, and in general, anyone who's going through the aging process will see changes in their sleep cycle. It's not just women, just to be clear. But definitely during this transition period, you may realize that there is a shift in your sleeping habits. And with the lack of sleep or just the general fatigue, some individuals may feel a difficulty like what just happened a few seconds ago, brain fog. So brain fog becomes more common, having these memory blips, harder to concentrate. Some individuals may have mental health shifts, such as anxiety symptoms, depression. One of the things that we don't talk about as much is introversion. So some individuals who used to go out and be very social, all of a sudden that don't you don't feel as social, you don't want to go out as much, or you're realizing that your girlfriend or your best friend, she doesn't go out as much anymore. That may be because she is going through the transition and she may be experiencing introversion. So keep that in mind. And with that, sometimes being intimate may change. Some women, because of dryness in the vajayjay, may find intimacy less pleasurable. They may have a lower desire to be intimate. They may actually feel that it is painful or uncomfortable to be intimate. And that may not necessarily be just secondary to the dryness. That may be just independently. One of the things that I personally experienced, which I commented on with Kev on stage's post, was that he mentioned the frozen shoulder. Frozen shoulder is an experience I personally had, and I can tell you it really came out of nowhere. Like it really came out of nowhere. And it took me a minute to even realize what was going on, to be fully transparent with you guys. Even as an OB, when these symptoms kind of creep up on you, there's really no warning sign, and you're going about your day, you're going about your life as usual, and all of a sudden, you can't move an extremity. You can't move your arm. And for a while, I really couldn't move my arm beyond here. Like that was the limit of my arm. And the individual, the sister friend that commented on that, I didn't realize that she was having the same experience. So shout out to you if you're watching this video. Thank you for your transparency, but it allowed us to have really good dialogue. And that really emphasizes the need for us to have these conversations so that people feel seen and so that people can be encouraged. Because for those of us who have experienced it, it's helpful to be able to share your experience and then also to encourage someone else to know that they will get to the other side. And it may vary how quickly they go through that transition, or how long they have the symptom for, but they will be able to get to the other side like everyone else. I will definitely say having a frozen shoulder and the inability to use an extremity. So my heart goes out to those who have that issue permanently because it really gave me such insight and helps me to be more empathetic towards my patient population because now I truly can see how it can, just the degree in which it is limiting. I would definitely tell you guys, I had my breakdown at the most random time. I had my breakdown, and it really plays on your mind, right? And it's weird telling people like I can't move my arm. Like I had a number of people in my loved ones, family, friends who were like, "What do you mean you can't move your arm? Like I saw you last week. You were moving your arm fine." And it happens that quickly. It was very painful. I do remember that. Sleeping was so uncomfortable. I could not sleep on that side. And it was a very trying time. I had my meltdown. My ultimate breakdown was trying to throw out the garbage. Y'all, I literally was like, this is not gonna work. I dealt with the limitations with the driving. I was able to compensate. I dealt with the limitations of even putting on certain tops was and just certain clothes I couldn't wear anymore because it was just absolutely impossible to get the top on and even worse to get the top off. But my breaking point was throwing out the garbage. Oh, it doesn't make sense, but that's what happened. And let me tell you why. Because first of all, I like to be independent. I like to be able to take care of myself. And the dumpster that I need to throw the garbage in is pretty tall. It's about maybe chest height for me. So with one arm, I have to lift the lid, and with the other arm, I have to be able to push or to throw the garbage in the dumpster. Well, I could not lift the lid with my compromised shoulder, with my compromised side. And so that was out of the bargain. But I figured if I generated enough momentum, this is the physics. I'm telling y'all, learn those physics to the kids that are out there, learn that physics. But this was the one time I was like, oh, if I generate enough acceleration, I can whip the bag into the dumpster. And I didn't realize I was starting to have a little bit of weakness of the extremity. So I could not generate the momentum. And I remember I had to try a couple of times before I can get the garbage into the dumpster. So that's just my personal experience as to the symptom that I have. And that was not my first symptom. My first symptom was actually allergies. So, and I had to talk to one of my good friends about this because she's just a brainiac. She was one of those double major biochem, have multiple degrees friend, because she's also a functional medicine doctor, and I consider functional medicine doctors like the investigators. So I was like, girl, please help me understand, why do I have allergies? So I called up my girlfriend and she broke down the histamine and this does that. And that conversation is beyond this conversation. But just to let you guys know, there are very much explainable biological reasons why you may have allergies. Some individuals may have more allergies than they had before. I had the worst itching. And it got to the point, I remember I went to Essence. I went to Essence with my mom, and I went to Essence with my mom and a good friend of mine. And I remember telling them because I was like, oh my gosh, I don't want them to just think like I got some kind of condition that may be infectious related. So my mom was definitely already aware of the circumstances, but I really didn't want my friend to be like, why is she itching like that? But I had really dry skin and I really had this itching episode and I broke out into this rash. I mean, my whole skin was inflamed. I remember my dermatologist came into the exam room. She touched my skin. She was like, oh, girl, you are inflamed. I felt it. It got so bad that that whole summer, y'all, my symptom was so bad. I did not sleep. I did not sleep well at all. Because the itching, it was just so uncontrollable. And I was just like, it cannot be like it has to be something. What's in the house? What is going on? I went to an allergist, did the whole workup because I wanted to make sure I wasn't again missing something else that was more concerning. But it turned out that it was menopause, and that was actually my first symptom. And it started sort of sporadically, and then I had this long episode over that summer. Um, but allergies, dry skin itching, hair loss, brittle nails, acne, skin sensitivity, skin thinning, those are all very common symptoms of menopausal changes. Some individuals may have hair loss completely, some may have thinning of the hair, some may actually have increased facial hair. Those androgens start to show up. They do too much sometimes, but some individuals may have increased facial hair in addition to the acne, or some individuals may find a deepening of their voice, and all of a sudden their voice is about 3 octaves lower, and you're trying to figure out why do I sound like a dude all of a sudden? It's your hormones. So some of the changes can really be unsettling, right? Some individuals may even have a change in their body odor. So keep that in mind. There's also joint and muscle pain changes, breast tenderness, breast lumps, breast fullness, and an increase in your breast size can happen, ladies. So you may actually increase your size during your transition into perimenopause and menopausal time period. And I will definitely tell you, there are some symptoms that are a little bit kind of weird. And some people may feel uncomfortable sharing certain symptoms because they're just trying to figure out, is it me? Am I the drama? Am I the crazy one? No, you are not crazy. You are having brain zaps. And for those of you who have experienced brain zaps, you know what I mean. Some may have tingling in their feet or numbness in their hands and feet. And then some may have crawling sensation on the skin. Like you feel like something's crawling on your skin. You're not losing it. You're not losing it. It may be your hormones. Yeah, so some symptoms can be really distressing. There are cardiac symptoms also. Some people may have palpitations, right? But as I mentioned, make sure you get evaluated to make sure that they are menopausal palpitations and not something more serious like a true arrhythmia. The vaginal tissue, the urethra, the bladder all have receptors for estrogen and progesterone. So some individuals, as mentioned, some women will experience dryness in the vajayjay. Some will have pain in the vajayjay. But then some may actually have other bothersome symptoms like recurrent infections in the vajayjay, like your BVs and your candidiasis. And other individuals may experience recurrent urinary tract infections and loss of urine, incontinence. Also, not just urinary incontinence, but also fecal incontinence. So, that being said, the symptoms are vast. And some people may even have like restless legs, right? And so, if you are noticing sudden onset, unusual symptoms, came out of nowhere, you're in the age range of late 30s through your 40s, early 50s, you may be having symptoms as a result of your reproductive hormonal changes. And because, again, these symptoms can be overlapping, you want to make sure that you are evaluated appropriately by your healthcare team. So you may be seeing your endocrinologist or you may be seeing your cardiologist, and you're kind of like, all of a sudden, I'm gaining a lot of midsection weight. And don't forget the fupa. I mean, who invited the fupa to the cookout? Is my question. That fupa shows up like, where did you come from? So you may be sharing those very personal details with a specialist that you happen to be seeing, thinking that it may be related to your cardiac issues or it may be related to your other hormonal issues. Sometimes you do have to kind of jog the mindset of specialists because we're so focused on our area to remember that you are a woman. I know it sounds crazy, but sometimes you do have to remind clinicians that you are a woman. That should jog the awareness of the clinician to remember, oh, yes, she's a woman, which means she may be going through a transition of sorts. And once you fully understand how estrogen and progesterone primarily affects all the organs in the body, or most of the organs in the body, then it's so much easier to really link a lot of symptoms together. So, my recommendation for you is to do a couple of things. One, I recommend that you write things down. So as you start to experience things, I want you to start to keep a journal. And the journal doesn't have to be in a formal journal. You can put this in your, in your notes section on your phone, but write down as you start to experience things. If you're having joint issues, write that down. When did it start? What are you experiencing? If your sleep pattern is changing, you're having difficulty falling asleep, write that down. And as you journal these things, even if they don't make sense in the moment, you may have that aha moment where you realize, oh my gosh, I think I may be going through the change. And that's really the goal, is to find out whether or not you are going through the change or if it's something else. The second thing I do want to recommend that you do is that you share your story and share your experiences, because ultimately womanhood is just one big global community. And the more we talk about our experience as women in society, in this world, and what it means biologically to be a woman, the more we have better discoveries, because y'all, the science ain't doing it. They are not looking at women's research at the rate and at the depth and at the range that they should. And so a lot of things are going to be anecdotal, where we talk to each other and we learn from each other. And we are able to support each other through transitions. And then three, I would say, if you have determined that you are going through the transition, of perimenopause or menopause, um, be informed of what your options are. And the management of your symptoms is going to vary for everyone. Not everyone is going to take HRT or be a candidate for HRT. Some individuals may want non-hormonal options or may just have such mild symptoms that they don't really need or want any medical intervention. Other individuals may use just your over-the-counter. Depending on if they're dealing with allergies, they may just use an over-the-counter allergy medication, which will be sufficient for their mild symptoms. So definitely don't pressure each other into making the same decision because everyone's symptoms are different, as you can see. Everyone's severity of symptoms may differ, and everyone have different medical problems, different goals, different lifestyles, and different risk factors. And so that conversation about whether or not to use HRT should be done with your healthcare team who knows the factors or the things that should be taken into account when making that decision with you or when guiding you through that decision making. So hopefully this conversation has brought light and has brought some enlightenment to your experiences. Hopefully you will share and please share this video with others, y'all. Not only is watching the video, liking the video important, and subscribing to the channel, of course, but also sharing the video is also important and the time frame in which you do it. So if you guys can do me a favor and watch this video or watch our episodes as close to the time that they come out as possible, because the closer you watch the videos to the time that they actually are published, the more the platform think that you find our content to be important and informative and valuable. And the more they push our videos out, we have been experiencing a lot of what seems like intentional down regulation or down visibility of our videos. And so it's very interesting to see. But yes, certain videos just they're like, we're just not going to make anybody see this. And so it's really important to have your active participation, your commentary, your likes. That being said, I say all of this to say I thank you, one, for watching and supporting us. But if you can do us the favor and increase your level of participation, it would truly, truly help us to get information like this out to the masses. That being said, my name is Dr. T, and I'm the hand behind the handle of Healthy Bump Club right here on YouTube and Healthy Bump Club on Instagram. I thank you guys for watching. I thank you for participating and supporting, and I hope to see you guys when? The next episode. And I'm out. This is Dr. T, just a friendly reminder. Don't forget to comment, like, and share. And go ahead, why not? Click that subscribe button. Help us to get to the next 1,000 subscribers. We thank you guys for supporting.